The next modality to fix the shoulder with is we call orthostam. If I determine your shoulder pain is coming from the neck or is coming from the ribs here. For example, if your neck C5, C6 has a impingement of the nerve because the bone is shifted. If the ribs is shifted and causing compression on the nerve, both of which can cause shoulder issue. So what I'm going to do, I will use the orthostam to move the bones of the ribs or move the bones of the neck as well too. And of course I would palpate to determine what section of the impingement of the nerve is. And again, if your condition is primarily compression of the neck and nothing else, then you usually get an instant relief of the shoulder pain, usually. Okay. Now next machine that we use, this is a very deep vibration treatment. What this does, it breaks out the adhesion. If you have a shoulder injury, and you've been having it, for example, if you work as a nurse and you carry patient all the time, you dress patient, you change the bed sheet, you carry heavy things, and you take care of patient every single day. You're gonna use your shoulder every single day, and your shoulder is already hurting, okay? And you rest it, you feel better, and you work again, and it hurts again, and you rest, and it gets better. Every time you rest, the shoulder heals, the scar forms, and you do the patient, and then the wound opens up, and you keep on doing that for years and years and years. Of course, a scar is going to develop, right? When a scar forms, it's not the scar tissue and muscle. It's going to be a total two different structure. If you have scar issue problem, your injury is going to be much faster. Your injury is going to be very unstable. Okay, so in order, if you have this kind of issue, then we got to make sure we take away the issue of the scar tissue, so or the adhesion or the spasm. Then we use machine to run the vibration around the scar area. And again, once the scar is broken, you're gonna feel the instant relief in your shoulder as well too. Instant. Okay. Okay. All right. Good. For this particular treatment protocol that we use for your shoulder, chronic shoulder pain, is we call it neurofeedback system. Now, if I checked your pulse, if I checked your body, your nervous system, your brain, and your muscle pain, the shoulder pain is because of the brain interruption. Because we showed you before that the pathway of the large diameter pathway from the brain to the shoulder, if there is a disconnection of the nerve pathway, then we gotta deal with the brain. We're gonna use machine to basically open up the brain channel, the nerve flow, so the muscle can start getting the healing. Okay, so what we do for a patient is we're going to use different electrode, and we put on different parts of the brain. It could be this 2 point, could be this 2 point. It depends on what I test. So if I figure out that your supraspinatus muscle is caused by C3, C4 point, then we're going to put the electrode on a C3, C4 point, and the computer is going to analyze your brain condition. Okay, and then we're going to use the computer to treat the nervous system of the brain, so to open up the nervous system of the brain. So the brain signal could be then transferred to your shoulder, then the healing will start. Okay, and we have successfully used this to treat a lot of different conditions. Could be shoulder, could be the knee, could be the back pain, neck pain, could be headache, and this machine we have had incredible results with this modality as well too. Okay. Next modality for your shoulder, chronic shoulder pain is we call it DRX 9000 spinal decompression machine. Assuming that your shoulder pain is a result of the compression of the nerve from your neck. whether C5, C6, whether C3, C4, C6, C7, it doesn't really matter. If the compression of the nerve comes from the neck and shoots down to the shoulder and causing severe shoulder pain, which happens a lot. And usually when you have this kind of shoulder pain, the symptom is not just one shoulder, it's sort of the entire shoulder. Sometimes it runs around, sometimes in the back, sometimes in the front. Okay, and the DRX 9000 decompression will actually work on your disc here, or for example C5, C6 disc herniation. It's going to open up the disc herniation and it's going to relax this, let go of the nerve compression, and when the nerve compression is let go, the nerve pain down the shoulder is going to be gone. It's going to be gone. Most of the time when patients have severe shoulder pain, they also accompany numbness of the entire arm, and this is always a result of the disc herniation on C5, C6. Okay, this machine is primarily to fix your disc herniation without the use of surgery or injection. Okay, so this is a very good machine for that.